Yes, Bhavna, we can start.
So nice to see Sejal also from Surat with us. And who else has joined apart from Riddhi, Sejal, and Kiran? And of course, our friend from Northeast, she's also there. So anybody else who has joined?
Parul has joined. Parul
Yeah.
Sahuji is
Hello,
another
sir.
good talent from Maharashtra. Dr. Nimish,
Yes, yes.
I would request you to invite all of these people who are from Maharashtra for the Surat conference.
Always, always. It's
Yeah, yeah.
see,
Madan, Parul, everyone is doing fantastic job.
yeah. No, it is
Thank you so much, sir.
our pleasure, and we'll be so happy to have all of you. We don't want to miss anyone.
Hello. Am I audible, sir?
Yes, we can hear you. Yes.
Good evening, sir. Good evening, all the dignitaries. Today's event is supported by Corona Remedies, and the event is a webinar which is named AMOGS Sexual Medicine Committee in association with Gujarat Obs and Gynae Societies. So, before moving ahead, I would like to introduce our conveners for today, Dr. Madan Kamble and Dr. Prerna Keshan. Dr. Madan Kamble is Chairperson AMOGS Sexual Medicine Committee National Coordinator, FOGSI Sexual Health and STI Committee, Chairperson AMOGS Sexual Medicine Committee 24-26, National Coordinator of FOGSI Sexual Health and STI Committee. I welcome you, sir.
Yes, thank you.
I would like to introduce Dr. Prerna Keshan. Dr. Prerna Keshan has a lot of feathers in her hat. She is East
Bhavna, I'll introduce myself.
Okay,
Just
sir.
a short one. I'm the national coordinator for Young Talent Promotion Committee of FOGSI, sir. And just that I'm from the remotest area of the East, and this is what I have been in FOGSI. And you can go ahead. No need to read out all these.
Okay, sir. So I would like to hand over the session to Dr. Madan Kamble for the light lightning session.
Yes, good evening, everyone. On behalf of AMOGS Sexual Medicine Committee, myself, Dr. Madan Kamble, Chairperson of Sexual Medicine Committee, take the privilege to welcome you all on this special occasion of this webinar, which is specially designed for to associated with Gujarat societies. We are very lucky to have 10 societies of Gujarat in this episode. Sorry. And we are covering next 12 societies of Gujarat in next episode. This time we have included the very sorry. We have included the societies of Ahmedabad, Surat, Baroda, Jamnagar, Mehsana, Palanpur, Bhavnagar, Junagadh, Porbandar, and Bhuj. I welcome all the office bearers of this society also, and thanks for participation. And with the blessings of AMOGS office bearers, our respected President Dr. Kiran Kurtukoti sir, who is the President of AMOGS, and Secretary Dr. Bipin Pandit sir, I welcome you all. And I welcome today's chief guest also, Dr. Alpesh Gandhi sir, and our guest of honors of today's webinar, Dr. Kiran Kurtukoti sir, Dr. Parul Kotrawala sir, Dr. MC Patel sir, and Dr. Nimish Shelar sir. And I also welcome my co-convener, Dr. Prerna and Dr. Parul Sahuji from Nagpur. Parul Sahuji is chairperson of AMOGS YTP committee. I welcome all the dignitaries for the lamp lighting. Bhavna, can you play Yes, thank you so much. Can I have the slide of Bhavna? Dr. Alpesh Gandhi, sir. I think sir has not joined yet. He will join in a minute. Can we go ahead till then? Yes,
Yes, please.
Bhavna?
Yes, sir.
Yeah. Next slide, guest of honor. Yes, Kiran sir. Yeah. Actually, sir doesn't need an introduction. He is the president of AMOGS, and he is the beloved person, very dynamic and fantastic personality of AMOGS, who has taken the AMOGS to a certain height. And I welcome our dear Kiran sir, and over to you, sir, for your blessings.
Thank you, Madan. Thank you for that honor. But I would request you that the other guests of honors are senior to me. So I would request Parul, MC Patel, and Dr. Nimish Shelat first to talk, and then I will give my opinion. Thank you so much. Thank you.
Sure, sir, sure. Yeah, Bhavna,
I'll
display the.
welcome Parul sir. Please give Dr. Parul sir's CV. Dr. Bhavna, please.
Yes.
Sir needs no introduction. Sir has been the past chair of ICOG and the vice president of ISOPAP 21-22. Sir is an endoscopic surgeon of international repute and was vice president of FOXY 2006. Sir is always a yes on a single phone call, and that is the most loving part of sir. And I have known sir over calls more than on live sessions. And sir, thank you so much for always being there for us as a pathfinder for many of us Foxians. We welcome you, sir, for this esteemed session, and we are looking forward towards your blessings, sir. Parul, sir.
Please unmute yourself, sir.
Hello, I hope I
Yes,
am
sir.
audible.
Yes,
Yes,
sir.
sir.
So when Dr. Kiran told about the seniority, then of course MC is senior most in terms of age, then Nimish, and then me. Anyway, I am jumping the gun, otherwise we keep on doing this. Well, it is indeed a pleasure to be part of this very important webinar. And I still remember my day, I was invited to speak in the AICOG CME at Hyderabad. Must be about 8-10 years back. Not the last AICOG, but the previous one. And the topic was sexuality and sexual dysfunction in perimenopause. And Dr. Behram was sort of chairing the session. He was at that time menopause committee person. And after it was over, few senior lady colleagues came over. Of course, they complimented as is the routine, but they said you are very brave to handle this topic. So at that time, that was the conservatism in our fraternity. But I'm sure I should compliment Manish Jadhav for bringing the sexual functions and sexuality to the forefront. And now I believe that any major conference of our fraternity has always a session on sexuality and sexual dysfunction. So we have now become quite open. And I'm sure with effort of all colleagues, society also is gradually opening up. I see Riddhi here. She has been with us during her student days, and she has now made it her career to focus upon this aspect of our specialty. So thank you very much for being part of this. And I'm sure deliberations would go a long way to the colleagues who attend this. And again, I would sort of say a word of best luck to Dr. MC for his pursuit for his Foxy endeavors. He is going to be a candidate for presidency of Foxy next year. Thank you so much.
Thank you, sir. It's always a treat to hear you speak, and we are really honored to have your blessings, sir.
Thank
We
you.
now welcome our next guest of honor, Dr. MC Patel, sir. Sir needs no introduction, and his credentials are something which cannot be enlisted in on a single slide. And sir has been a pioneer for so many institutional work in our federation. And sir is the president of AOGS in 2011 and President IMA Ahmedabad 2007-8 and national president of NMO 2016-18. And sir has been the chairperson of the Ethics and Medical Legal Committee in 2011-13. And every one of us know how much in depth sir is into the field of medical legal issues and how much we have all learned from sir as far as the medical legal and ethics of my federation as well as gynecology and obstetrics is concerned. We welcome you, sir, to this esteemed scientific session, and we are here to have your blessings, sir. So the dais is all yours.
Thank you, Prerna, for kind words. So let me congratulate first Madan and all team to keep this subject for a webinar and discussion. And rightly said by Dr. Parul Kotlawala, previously this subject, totally sexuality and sexual medicine, etc., they were a subject, I would say they were ignored or less discussed, rather not at all discussed in conferences or webinar or in CME or so. But after this committee was led by Dr. Neeraj, and then now Apurva is heading, and hopefully Madan will be taking over. So they have collectively worked so hard and put this committee to such a height that this committee has drawn attention of all the Foxian, I would say, or Foxy leaders to keep this subject in each and every conference for discussion. So my compliments to team for making this subject so vibrant, I would say, to the Foxian people. So thanking you again, Madan, for inviting me to be guest of honor to bless the occasion. And thank you, Prerna, again for kind words. Thank you.
Thank you, sir. And we all wish you the best for your future endeavors, sir. And we are all with you. Thank you so much, sir, for being here. Dr.
Yeah.
Parul, can you take up?
Yes, thank you so much, sir, for your kind words and blessings, and best wishes for your candidature. And thank you, Parul, sir, also.
Thank you.
Madan and Dr.
Yes.
Prerna, let me interject one little experience.
Yes.
I was chairing the Adolescent Health Committee of Fox years back.
Yes,
And
sir.
in one of the school health education program, one of the most prominent school of Ahmedabad, Udgam school is very prominent school. I was asked to address the standard 11th and 12th girls, that is higher secondary. And then the principal, before the presentation, spoke to me. The doctor, you discuss everything, but don't touch upon the sexual part. So I told her I have just 2 slides on sexual abuse. Rest of it is all other aspects, menstruation.
Sir's network, I think Madan sir is
He has lost.
weak. We lost him, yeah. So meanwhile, can we take the next slide? And then once Parul sir joins again, then we can just
Yes.
have him have his experience shared with us. It's an honor and a privilege to welcome our next guest of honor, Dr. Nimish Shalat sir. He's the chairman Foxy AICOG 2027, which is going to be held at Surat. He's the former national vice president Foxy. He has been the chairperson for Foxy Reproductive Endocrinology Committee. He's the pioneer and the senior most IVF specialist practicing in Gujarat. So, sir, we wholeheartedly welcome you and we would really want you to enlighten us with your words of wisdom.
Thank you. Am I audible and visible?
Yes, sir.
Yes,
Right.
sir.
Yeah, because I'm unable to visualize my video on the screen. But anyway, as long as you can see me, it's fine. Well, Parul, that were nice, kind words of introduction of a few words regarding what I stand for. But there is a lot to my career which doesn't appear on this slide. I had sent a full proper CV to your organizing team, but I don't know why it has been edited so shortly. Anyway, it doesn't matter now. Let me introduce myself because I feel there is something which is not completed in this slide. Basically, I have been with Foxy for last almost 42 years. I have been with Foxy for so many years, and I have been with almost all AICOGs. I have been National Vice President of Foxy with chairing Endocrinology Committee for many, many years. That was from 1997 to 2003. And I have also been on the Indian College of Obstetricians and Gynecologists Governing Council for 12 years. I have been meeting all of you in various conferences, and some of you who are younger, I'll be very much happy to see them at All India Conference of Obstetrics and Gynecology. I was also the president of all Gujarat Obs Gyn societies, president of Indian Society of Assisted Reproduction, Gujarat chapter, as well as I am currently the president of Surat Obstetrics and Gynecological Society Educational and Charitable Trust. I'm an honorary visiting professor to Gujarat University School of Sciences, and I have also trained and taught medical students at European medical schools, which include the St. George's Hospital Medical School, University of London, Catholic University of Leuven in Belgium, and also University Wales School of Medicine in Cardiff, United Kingdom. So it has been a great pleasure to have been worked for 5 years in National Health Service of United Kingdom, right from 1985 to 89. That gave me a tremendous boost and experience on the various aspects of obstetrics and gynecology at an international level, having worked in a British hospital. It was a great pleasure to join and be in Surat from 1989 onwards. And I have worked tirelessly and extremely hard to work for IVF because that was in vogue at that time. It was very difficult to set up an IVF unit, and I am the first to set up any IVF lab in the state of Gujarat. And we gave the first IVF baby of Gujarat way back in 1995. That's almost 30 years. We work relentlessly, and my other, of course, passion is fallopian tubes, on which I'm doing a lot of research work. And any one of you who are interested in that particular area, please don't hesitate to contact me. Well, coming to today's topic and the webinar, which is also very, very interesting, and I'm honored to be a part of this whole program as a guest of honor. It's a great pleasure to be here on this podium and having so many various faculties who have been working relentlessly in the field of sexual medicine. In fact, Neeraj Jadhav, I'm proud of him. He's from Gujarat and Sogok, who has been elected now the vice president, and he held that committee for 3 years previously. And that was also adjudged as the best committee for that particular tenure and got the best committee prize from Foxy. So sexual medicine is now gradually coming up into its more and more vibrant, existence with more and more openness and its own willingness to be an open subject, which can be discussed in a very positive way, constructively, and which can solve a lot of problems which deal with emotional as well as psychological and physical aspects of human sexuality. Apart from this, the Sexual Medicine Committee has also rejuvenated in a way cosmetic gynecology, because there's another committee which has come up with the elevation of sexual medicine. So in fact, Foxy is now moving into all directions, and also it is also improvising and adding to more and more armamentarium of its various activities, which adds to the varied interest of so many of obstetricians and gynecologists, because general obstetrics and gynecology is practiced now by selected gynecologists, and many of them, especially the young ones, want to specialize much earlier, and they want to go into various fields like urology or imaging sciences or reproductive endocrinology or endoscopic surgery and menopause. So many areas where we can work, and that's why today this particular area of sexual medicine we will really enjoy, and I'm here with great thanks to all of you for having invited me for this particular program. Thank you very much.
Thank you so much, sir, for your kind words and blessings.
Parul
We are eager to be part of
has
your
rejoined. Parul sir
2027. Thank you so much, sir. Yes, Parul.
Sir is rejoined. Sir, you are sharing some experience, Parul sir.
No, I hope I am audible.
Yes,
Yeah.
sir.
Yes.
It was just saying that such was the time, and things have changed over last so many years. And I'm sure that we will be very free society as far as discussing our issues regarding sexuality and dysfunction. And so let us have a good webinar just now. Sorry
Yes,
that I
thank-
got disconnected suddenly.
Thank you so much,
Kiran,
sir.
sir.
Thank you so much. Then we come to our own President AMOGS, Dr. Kiran, sir, for his kind blessings. Over to you, sir.
Thank you, Madan. Thank you. Thank you for that honor. And really a warm welcome on behalf of AMOGS to all Gujarat societies, as well as the doyens of Gujarat. I see Dr. MC Patel, Dr. Nimish Shelat, of course, my sister from Gujarat, Sejal Naik, and Archana ji is also there, Prerna, and everyone, and Nimish ji also. And in fact, we have been seeing lot of all of you for n number of times since the last 1 year or so. Nimish bhai, thank you for being there when I was installed as the president, and I'm sure that we are going to have a ball at the AICOG. Thank you, Dr. MC Patel and Parul also. We expect a lot of things at ISAR also. We are rushing to ISAR at Ahmedabad in huge numbers. So thank you so much. And Prerna, best wishes to you. Best wishes to Madan and Archana ji and everyone. We really enjoyed all those Garba things that you did at Pune. And so thank you so much. And Gujarat and Pune, I mean, I would say that they are sister states. Whenever somebody from Gujarat or whenever somebody from Maharashtra is there, I think with the blessings and best wishes of each other societies, I think we'll roll and have a great ball. So thank you, Madan, and best wishes to you also, and best wishes to Parul Sauji also, whenever she decides in whatever capacity she wants to join in AMOGS or Foxy. Thank you so much, Prerna ji. Best wishes. You are the odd girl out from Northeast, but I'm sure that you have assimilated and gelled so well with all of us that we feel that you are our part only. So thank you so much
Thank you
for
so
being
much.
the coordinator for this program. Thank you. And Riddhi ji, best wishes to you also. Thank you so much. Dr. MC Patel, looking forward to meet you at Karwar also, probably. Karwar also we'll meet and have a nice time. Thank you so much.
Thank you.
Yeah. Thank you so much, sir, for being with us today. Dr. Alpesh Gandhi, sir, is busy, occupied, and he may join later. Yes. Thank you so much once again, all the dignitaries, for coming and blessing us. Over to you, Parul.
Thank you so much,
to
sir.
start the scientific. Yeah. Thank you
So
so much.
without much ado, we'll start our scientific program for this evening. The session 1 is sexual health at midlife. And to invite our speaker, I would just want chairperson slides. So we have chairpersons for this particular session, Dr. Parth Shah sir from Ahmedabad, Dr. Kokila Desai ma'am from Surat, and Dr. Sejal Naik ma'am from Surat yet again. So I would request our chairpersons, Dr. Parth Shah sir, he's a secretary Ahmedabad Society and director at Rajni Women's Hospital. Dr. Kokila Desai ma'am has been practicing as Chief Fertility Specialist at the International Fertility IVF Center, Surat. She's done her graduation and post-graduation from MS University, Vadodara. She has taken advanced laparoscopy training and sonography from various institutes of Mumbai, Kochi, Pune and Ahmedabad. She has been the past president of BGDC, past treasurer of BGDC, member of ESHRE, Foxy, SOGS and life member of so many organizations. Ma'am has presented a lot of papers and has been invited as a faculty at various conferences. She's done a fellowship in reproductive endocrinology from Germany. We welcome you, ma'am. And we have Dr. Sejal Naik, ma'am. She is the treasurer of IAG 2025. She's the chairperson, endoscopy committee, Foxy 2025 to 2027. She's the managing committee member for Gujarat chapter ISAR. And she runs IAG and Foxy accredited training center for gynecological endoscopy since 2020. She has a lot of awards in her kitty. She's the IAG Teacher Power Excellence Award in 2024. She got GEM Member Award of IAG 2022. She has been awarded a lot of Best Papers, Foxy Young Achiever Award, Appreciation Award by SOGOG, and a lot more. She has landmark contributions as the national convener for Eagle Project, which has been going on, which has trained more than 7,500 students so far, and she's the organizing secretary for the AICOG 2027. We welcome you, Sejal ma'am.
Thank you for very kind words.
So we would request our chairpersons to introduce our very dynamic and a very loving person whom I know very personally, Dr. Riddhi Shukla ma'am. So we request our chairpersons to introduce our speaker who's going to be talking on sexual health at midlife.
So, shall I start or Dr. Kokila is there?
Ma'am, I think you can take it from here.
So it's a pride privilege to be here on this very interesting topic today on sexuality with these Sexual Health Medicine Committee. Dr. Neeraj Yadav has took this committee to the newer heights. After that, that is all his commitment and the work toward the committee led him to the VP post easily. So it is what the committee we are looking forward to take this committee to the higher level, and each and every member of the Foxians are always, as seniors have said, they are always keen to listen to the various topics and various conflicts on these very delicate issues on the sexuality. Now, midlife, as we all know, it's a transition, and the sexuality during the midlife that requires compassionate care, proper understanding. So here I'm looking forward Dr. Riddhi Shukla. She is MD DGO and from Ahmedabad, and she's a cosmetic gynecologist and senior practitioners consultant gynecologist in Ahmedabad. And she's a director of Arogya Specialty Hospital and visiting consultant at various places. And she will be talking about the sexuality in midlife. And as we all know, we shall be able to open the doors of this during the midlife and the change, transitional, emotional, physical, and the many barriers are there in this time frame where she requires a special attention from the not only from the doctors, from the family as well. And here I would like to wish Dr. Madanji for his upcoming elections and all the very best. He will take this committee to the newer heights, and all the other contestants as well. Dr. Prerna, Dr. MC Patel sir, and all. So,
Thank you so much.
Dr. Riddhi, we welcome you.
Can you allow me to share my screen? I'm not able to share it.
You can try now, ma'am.
Okay. So good evening, everyone. Thank you, Madan and organizer, for giving me an opportunity to present my thoughts about sexuality at midlife. As Dr. Nimesh sir has said that there are so many Is my screen visible?
No, ma'am.
Uh,
Ma'am, I have also made you the co-host. I guess now you can share. Can you please try?
the share option is not opening.
The green button?
So I'm getting share documents and advance, present as layout. I'm not getting the share option.
It is right on the side of reflect and host tools.
Uh,
Maybe, ma'am, on the lowermost end, you can just see one green arrow saying share.
Yes, ma'am.
no,
Can you see that, Riddhi, ma'am?
no, I am not able to see. Green arrow, I have said share. Then I am
Yeah.
so one participant can share at a time, right?
Yeah.
Yeah, ma'am.
Do you have your presentation open in the
Yeah, it is open.
desktop?
Is it on slideshow?
No.
You can share it on mail to Bhavna. She can do it for you. Bhavna, send your ID on chat box.
So my presentation is now open.
So, ma'am, once you press this share button, you would be able to see your presentation as one of the things which you want to share on the screen here.
So I have shared, I have green button. Then
Yes,
I am
ma'am.
sharing one participant I can share at a time.
Yeah.
And
तो
then
रिद्धि मैम एक बार लॉग आउट करके लॉग इन कीजिएगा
ठीक है, चलो
इमीडिएट
करते हैं।
Bhavna, you will have to make her co-host yet again once she joins in.
Okay, ma'am.
Dr. Bhavna, hello? Is Bhavna?
Yes, ma'am.
You can by the time call her and get it on mail also if she's not able to do it.
Ma'am, I guess Madan sir will be taking care of it.
I think ma'am has not joined again, no?
Ma'am has joined right now, sir.
Okay. Please
Bhavna,
make her
just make her
co-host.
the co-host. Bhavna, have you made her the co-host?
Yes, ma'am. I made her
हाँ,
made
हो गया.
Riddhi ma'am the co-host.
Riddhi ma'am, unmute yourself, please.
Yeah, so when I am putting I am pressing a green arrow,
Yes,
Yeah.
ma'am.
I am getting an option of share. Share as one participant can share at a time, advanced sharing option and multiple participant.
Share screen, you
Click on any, ma'am. Can you click on any one and see what pops up next?
So
Have you joined from a tab or something?
So because usually when you press the share button, ma'am, the application windows which are there
So
open
do
for
I
you.
have to put a content only as background?
Ma'am,
over?
content only. Content
Yeah,
only.
so
You just
that
put
is
it.
only I have that only I have to I have a
So, ma'am, that is the presenter layout. You just
Yeah.
see the application windows which you can see on the other side. So your PPT should be seen in one of the small icons which you can see on that left-hand side.
No, it is not same.
Riddhi, is your
Ma'am,
PPT
please.
open?
Yeah, my PPT is open, sir.
And you are pressing the share button and
Yes, sir.
Then your screen is not seen? Your desktop screen?
No, my desktop screen is not showing. That's what I'm saying. When I'm clicking
any
the
of
share button,
Ma'am, are there any 3 options after share button coming like screens, documents, and
No.
advanced?
it's a host only or all participant?
All participants, ma'am.
That is a one participant can share at a time.
Yes, so somebody might be sharing just now. That person has to disconnect.
Yes,
No,
somebody
sir,
has.
nobody is sharing right now. I can see it on
Okay.
my screen.
Then one thing is Riddhi, log off and relog.
So she's
Yeah,
done that
also I
right
have
now.
done,
only.
sir.
Done that.
That she has already done.
Yes,
Okay.
sir.
Yes, sir.
And mail
I
your
think
mail
if
PPT,
somebody
no?
mail the PPT to Prerna or Madan, they
Or
will
maybe we
do it.
can start with the second
Presentation. And you can do
presentation
it
and
at the
then I
second.
can plan something and
One suggestion I had is that if you can, leave the meeting right now and then try to rejoin from the very beginning, taking all steps, I think it might work. Just a suggestion. And
Yeah,
we-
This
that also,
this
sir, I
they
have
have
done.
done already. The only
Sir.
thing is you can change your device if you can.
The Dr.
I
Riddhi,
think we can
mail
have
or
a
we-
mail presentation. Predna, you can continue with the second. वो
Yes.
ज़्यादा better option है.
yes, yes.
A second,
So
Neeraj sir has also not joined. Riddhi ma'am, can you share your presentation that so that we could share from our end?
Let
please
me.
mail to Bhavna. Bhavna, please
So,
get it on mail.
when I am making a share, then the share button is not coming to the down. Green I am
Not
sharing.
Dr. Riddhi, please send PPT on mail to Bhavna.
Yeah.
Bhavna, do you have Riddhi?
One or
Bhavna,
anyone, or Prerna or me also. You
मदन
can
आप
share.
ले लीजिए.
Let me try.
You send your ID, Dr. Madan.
Yeah, I'll do that.
नीरज सर को फोन करूं क्या by this time?
Okay. Ma'am, you have an Apple device or a Windows device?
I have an Apple device.
So, ma'am, whenever you're pressing this share button,
Yeah, I
are
am
you not
pressing the share button
Mhm.
and yes, now I've got it.
Yeah, yes.
Yeah.
So now
Yes,
you do it.
come.
Yeah.
Come.
I think we needed to know which device ma'am is using.
Yeah, so my devices was not getting the green button.
Yeah.
Sorry for the delay. Thank you, Madan, and organizing people for giving me an opportunity without wasting a much time. We'll be directly jumping to the topic that is a sexual health at midlife. And as we all know that this is a very crisp definition of a sexual health. So it is bound with physical and mental health completely. Sometimes when you see that patient do have some sort of a problem and all the investigations are coming to the normal, or many of the time during your counseling you do find that patient is not speaking up enough, then there can be some sexual problem lying inside. So it is a World Health Organization, I said it is a overall health, not just the physical, mental, but social, sexual, and emotional health is equally important. And it's not merely limited to absence of disease or dysfunction. So this is when the study over the sexuality started. This was the first model presented to us regarding the linear model having a EPOR, that is excitement, play to orgasm and resolution. But now what we come in a practice is a very beautiful intimacy based model of female sexual response cycle. Here if you see that every phase of a sexuality is interconnected with each other. A women who do not have a desire to have a sex, she will not get aroused and she will have a painful sex, and that is getting noticed into her mind, and then she is getting continuously in the cycle of a sexual dysfunction. And similarly, a woman who are desire to have orgasm or who are not getting orgasm or who have a painful sex, then again she won't have a desire, and then it will go on and on. So whenever you are dealing with a women of a sexual dysfunction, you need to see all the four aspects of the sexual response cycle, and all four phases of the sexual response cycles are extremely important. As Sir has rightly said, that sex and sexuality is still considered to be a taboo, and we need to understand it is a natural need, and it has to, can I ask everybody to mute that I am getting some noise from somebody? So we need to understand that sexuality is a natural need. It has to live by choice, not by a chance. Sexual health of Indian women are much more important because sexuality is attained either into a marriage or a relationship, and Indian women are spending whole of their life with just a single partner. So where if that sexual problems are lying below the surface and not addressed at a proper time, then her overall health and the whole relationship is at a risk. So talking about female sexuality, In the vagina, the lower 1/3 of anterior region has been proved to have a more nerve histochemically, and it is known that response of a distant anterior vaginal wall to contact and pressure is higher than the other part of the vagina in penis vaginal penetration. Why I am sharing this slide? Because can I ask everybody to please mute themselves? I'm getting. So why I'm sharing this slide is because here when we are talking women of a mid age and beyond, they do have a problem in their anterior vaginal wall because those area that
Bhavna, please
everybody.
mute everyone else. Bhavna.
And it has been said that desire, arousal, and orgasmic disorder are the most common cause of female sexual dysfunction. Sexual stimulation in women is known to be provided mostly by the touching, and the most sensitive point to stimulate in the female body is the genital area. This whole genital area, what we call a clitoral vaginal complex, it is a hormone sensitive. And when we are talking about a sexuality of a mid-age women, that we need to understand that estrogen is going down gradually, and it is going to be a completely deprived after a menopause and beyond. Then this area is affected anatomically as well as physiologically. So when you are addressing the mid-age women, to understand the anatomy, physiological changes in that particular area is extremely important. This is effect of aging in the male partner and effect of aging in the female. If you will see that excitation phase is reduced, there is a reduced lubrication and vagina does not expand as much as, which leads to a difficulty in accommodating the erect penis. When going to the plateau phase, older female takes more stimulation time to get and stay aroused. Orgasm phase, because muscle contraction may be fewer, because the pelvic floor muscle is also because of the aging, they are losing that tone and contractile efficacy. So there is a fewer contraction leading to less intense orgasm due to weakness of these muscles, and resolution phase body may take less time to return to the normal state. Talking about vaginal laxity, which is very common in a mid-age and beyond, it is a sensation of vaginal looseness which developed after pregnancy or vaginal delivery, or maybe effect of merely aging, and it is a very poorly investigated symptom of pelvic floor dysfunction. There is a complaint of vaginal looseness. When you examine the patient, there is no cystocele, no rectocele, there is nothing. Only the introitus is gapping, and many of the time we ask women that there is nothing, you can go back. No, it is not like that. Only vaginal looseness, a complaint of vaginal looseness without any compartmental symptoms, there can be a sexual problem. So it has to be differentiated from pelvic organ prolapse, and it is underreported, but the incidence is as high as 23 to 38%. When we are addressing, there is something called a gratifications. So gratification refers to a pleasurable feeling or satisfaction that arises when an individual fulfills need, achieve goal. So when we are talking about sexuality of mid-age, as a female healthcare provider, it is our responsibility to give a gratification at mid-age and beyond. There is a new era of management of sexual health issue, which is a non-pharmacological, pharmacological, energy-based device, PRP, GFC, cell-based therapy, Botox, fillers, and surgical intervention. Dr. Nimeshwar has said that younger generation in a gynecology, they are choosing one specific forte of the practice. But what I have seen is my practice that I am still a hardcore obstetrician, and I still do a complete OBGYN practice, and sexual health and aesthetic gynecology is a part of my practice. I have not completely switched over. But what I have realized in last 10 years, that after adding these two spectrum in my clinical practice, I feel that I am able to deliver 100% to female, because sexual health of a woman is many of the time is not discussed, not asked for, and then it is a need of a time for all the age group, young generation as well as the mid-age and menopause. Many of the time it happens that any client comes out, especially in two extreme, either very young maybe she is a married or unmarried, irrespective, and older women, then we do not ask about their sexual problem, because we do feel that, or we do consider that they might not be sexual active, which is a completely wrong practice. So irrespective of age, what I have realized, that irrespective of age, irrespective of their marital status, or irrespective of their partner condition, we need to ask about their sexual history. It is any healthcare provider's responsibility, because as sir has said, that it is still a taboo, but it is a taboo for healthcare professional first. So we need to take out that taboo from our mind and start asking about sexual problem. And selection criteria for a specific treatment is a, we need to take a detailed sexual history. There are various codes are available, it is very easy. What you need to do is spare just 2 minutes of extra time of your consultation, and dare to ask about their sexual you have just have to ask that, do you have any sexual problem, is your sexual life is satisfactory or not. And this 1 minute can pop up so many problems, which is just a tip of iceberg what we are seeing right now. Dr. Parul sir has shared his experience. The similar experience I would like to share, that I also went to some school, and I was asked about a principal who was happened to be my friend, and she asked me that you do not talk in detail about, you just make touch and go. But after the session, when the young generation, the questions which they asked, me and the principal both were yeah, having trembles in our legs. So it is a very misnomer that things are taboo. It is always better that we have to give a proper education, especially adolescent sexuality, so we can ask young generation or prevent any women to going to Dr. Google. And we as a healthcare provider should give them a better knowledge and awareness about sexual problem. So it is a general and local evaluation. We have to see presence of a female sexual disorder, whether there is only arousal problem or a desire problem, or pain is also there, or she is having desire to have orgasm. As I said, female sexuality is a Pandora box. It is very difficult. Women are completely having a happy sexual life without getting orgasm, and there are women who want to have a multiple orgasm. And so there is a wide spectrum. So it is very important to ask or make them aware about that, what is orgasm. So when I do deal with my client, what I do, that I explain them there are 4 stages of a sexual response cycle. So which stage you are having problem, whether you are not having desire to have sex. So we need to make them understand in their own vernacular language. Patient might be educated, non-educated, but when you convey them that there are 4 stages, which stage you are having problem, and what is orgasm and what is satisfaction. There can be any prevailing conditions associated, like genitourinary syndrome of menopause, pelvic organ prolapse, genitopelvic pain disorders. Especially these 3 associated condition can be there in a mid-age and beyond. And we do have to ask, she might have a discomfort, or she might have a absolute desire. She might not have any discomfort, but she might have a, because what we have seen, or many sexual health studies have shown, that women are getting their best orgasm or best sexual experiences in a age of 40s and beyond. So it can be her desire to have a better sexual life. So there has to be a tailor-made approach for every patient. There are various erotic zones of every woman. It's not restricted to a pelvic, genital and pelvic area. Women can get aroused by any other erotic zone like breast, nipple, or earlobe, and many other. So you need to ask women, you have to make her aware about that when she has a desire problem, that and when she has a pelvic organ prolapse or a GSM, then she can be make aroused with using a different erotic zone on her body rather than a pelvic area, because there is a dryness, it is a aging vagina, she may get a painful sex. So before she penetration, if she is getting aroused by a different erotic zones, then problem can be solved. We need to understand couple dynamics. It can be desire of one partner or both. We need to explain the procedures, what therapy you are going to, it is a couple therapy or mindful therapy or a CBT. So you have to explain that what are these therapies you are going to offer. Always use a pocket friendly material. PRP growth factor concentration are easily available and they are cheaper option for a vaginal genitourinary syndrome of menopause, for rejuvenation of a vulvovaginal area. Of course, energy-based devices are there. Sexual health of women is equally important. Orgasmic pleasure is a right of every individual. Very interesting. I did my 1 year fellowship in a sexual medicine from psychosexual medicine from Mysore Medical College, where the Plicit model of counseling was taught to us. It is absolutely a beautiful model where 90% of patients are just getting treated by using this model of counseling. P is stands for a permission, LI is for a limited information, SS for specific suggestion, and IT is a intervention therapy. So just by giving permission to patient that here is a safe space, you can talk about your sexual problem and the things are done and they will start talking. Then you just give them a limited information like these are the sexual response cycle, and then they will come out with their problem, and then you give just specific suggestion. If she has a problem with the desire, you just see that how she can get aroused and then just leave the things. And only intensive therapy is practiced only when it is required. But what I have, after adding this degree of a psychosexual medicine in my practice, what I have learned is that majority of couple, they are treated without any intervention. Then you can ask them to use various sexual position because mid-age and beyond women do have arthritis, genitourinary syndrome of menopause. So looking to their physical condition, you can ask them to use various sexual positions, then do a psychotherapy or a censored focus, CBT, this systemic desensitization. These all things were taught to us in a one day module during our course. Then you can ask them for a couple therapy, mindful therapy. These all therapies are very detailed things because of just 15-20 minutes. It's very difficult to explain all of them, but I'm just listing what I'm practicing in my sexual medicine practice. Then pelvic floor muscle therapy. See, pelvic floor muscle tightening is not the option. There are women, because of the GSM, there are some tender points. So all the pelvic floor strengthening is not the option. When there is a tender point, you just give a gentle massage and try to relieve that tender point, or you can use a Botox, or you can use energy-based device to take care of that tender area or a specific tender point. What we do in our clinical practice is something called a mapping of a pain. So in a vulvovaginal area, gently you can touch with your finger or a earbud that which are the tender points, and then you mark that area and take care of that area with gentle massaging. Because mid and beyond, because of the muscle dysfunction or a atrophic of a vagina, there can be a tender point. So just deal with those tender point by gentle massaging or a special therapy. Then it is done. For women who are having a desire to have a better arousal, you can ask them for a touch technique, or arousal devices are available. Sacral nerve stimulator are available. Then comes to a pharmacological, that is a hormonal treatment and various pharmacological medicine. This is a list of medicines which are used for sexual dysfunction procedures. And then coming to a hormone, the two hormones which are used, they are estrogen and testosterone. I missed the slide for a testosterone therapy. Yeah, so this is testosterone creams and gels are available. Of course, it is not FDA approved for the females, but for a women of a mid-age and beyond, when there is a problem with a desire, arousal, and getting the sexual orgasm, the off-label use of these FDA approved products, which is used for a man, can be used in a 1/10 dose, which is used for a male patients. Ideal goal of therapy is These are because you are using testosterone, you have to keep watch on a side effect. All these are all you can get easily on your reading material. This is the estrogen. We all are very well versed with the estrogen therapy. And coming to the platelet-rich plasma or growth factor concentration in form of a various shots. That is a P shot used for a male partner. Then G shot and O shot are used for a female partners. The first use of sexual dysfunction was used by Charles Runnels under the name of O shot, which is a term which is you cannot use in a clinical because it is a trademark. So basically what is done, as I told you, that this is a area of a significant these are the area having a maximum nerve stimulation. There are more than 7 to 8,000 nerve ending in this particular area, and only function of a clitoris is the pleasure, pleasure and pleasure. So platelet rich plasma, which is used on a whole of the body part for a regeneration or rejuvenation for knee, hair, skin, the same product is used in this particular area for a sexual gratification, used on a genitalia on basis of the other body parts. So injection of PRP on clitoris, labia and G-spot what we practice. Then feelers are, because feelers are a viscous material, and women who are having mid-age, there is a vaginal laxity. So whenever male partner is inserting the penis, because of the laxity, it is not touching the anterior vaginal wall. And as we all have known that maximum stimulation in the anterior vaginal wall. So what we need to do is a bulking agent in the anterior vaginal wall. So when you are injecting viscous material, that G area, which is called a arousal area, it can be a G spot but or a other spot, but broadly it is a sensitive area or most important area for arousal. So when you are injecting some viscous material, the bulk is provided to that area, and when penis is inserted, it is getting immediately aroused, and this is how it can be used. It can be injected vaginally or transurethral. If you are injecting vaginally, you can put K90 catheter, and aim is to increase bulk of that area. So this is a penile shot. We may not go into detail. Then coming to energy-based device. So energy-based device is used in a two-way for a women of mid-age. One is you are taking care of the whole vulvovaginal atrophy. I have more than 300 patients in last 10 years now for menopausal and mid-age women, where we are treating vulvovaginal atrophy with a laser and PRP or GFC. So either you take care of the whole of the vagina when patients are having a vulvovaginal atrophy. If not, then only the anterior region, which is a sensitive, you mark that area, and low dose energy is applied in a anterior vaginal wall for revitalization. So either RBM smooth mode or a low dose CO2 laser can be applied, or vaginal tightening can be done through various energy, surgically, mid-age and beyond. As I said, vaginal laxity is a clinically significant condition. Pelvic organ prolapse does cause significant sexual dysfunction. For pelvic organ prolapse, we are doing site-specific repair. But when there is only introitus gapping, the procedure what we use is called a perineoplasty. These are the various evidence that influence of pelvic organ prolapse on a sexual dysfunction. These are the symptoms and indication of perineoplasty. Even if when there is a pelvic organ prolapse and there is a vaginal introitus is gapping, then you have to take a repair of perineum along with. But there are patients who are in their early 40s, there is no pelvic organ prolapse, only introitus is gapping. These are the patient when you are performing perineoplasty. So what happens, that labia majora, because of the introital gapping which are lying this way, when you are do a perineum repair, then they are coming into the center. So ultimately the vaginal caliber is decreasing. So there is a more strength into the vagina. So this one surgery is called a masterpiece of the aesthetic surgical practice, because the labia majora which are gapping, they are coming into the center. So labia minora is getting hidden, clitoris coming more to the anterior area, and a posterior repair is done. So these 10 minutes procedures, either along with the pelvic organ prolapse or isolated one, help women to get a sexual problem resolved. So this is a result of surgical intervention, because mid-age and we are concerned with the caliber, depth. There is a change in the angle because vagina is like the penis is going in the posterior direction. So there is a change in the angle of a mid-age women. So when you are performing any surgery, you are taking care of all these four parameters: caliber, depth, angle, as well as adding length and bulk to the perineum. This is a patient of a isolated introital gapping, where I have done a perineoplasty, and you can see that there is a change in a angle also, as well as a tissue bulk also. In my experience, there is a huge unmet need of a sexual problem of a women. Every gynecologist has to practice sexual medicine. It's a very easy to practice. All the parameters for indexes are easily available. You just take out the print, ask patient when they are waiting for their turn to come, they can fill up their factual indexes, and then you can come to know that okay, she has a problem in this particular area. You can practice explicit model, which is very easy. It is economics versus happiness or self-esteem. There is a huge paradox in the world, in the Western world and Indian world. But for Indian women, I would say that sexual health of Indian women are equally important as a Western world. This is a pictures of my female sexual health clinic which we run. So you need to use a customized model, local language. You have to keep in mind a social cultural context. You can provide online consultation when they cannot come for these taboo subject to you, but you can open up their consultation. These are various tools I'm using for my practice. This is a vulva model. I've got it made from one sculpture artist who happened to be my patient. She was on her 21 year of age, and she has beautifully made this POP model for me. And this is my clinic, where salient features because they have come with a purpose of a sexual problem. That purpose has to be well defined. You have to maintain a privacy. You need to hear with patients. You have to provide perfect diagnosis and proper treatment. These are the various panels I keep. So when you keep certain panels, they do understand that this is a safe place where you can talk about their sexual problem. And of course, when you are dealing with a womanhood, delicacy and dignity of womanhood has to be maintained. Thank you very much for patient hearing.
Thank you so much, Riddhi ma'am. It was a fantastic presentation as usual, and very comprehensive. At the chairpersons, we would like to have your inputs.
I think
Sejal ma'am is not there.
Sejal ma'am had messaged her that she's in a poor network zone.
Okay.
We have our experts for the second session as well, Dr. Neeta, Dr. Archana, and also they can also give their
Yes,
inputs
any
on this.
faculty. Any faculty can give their
And
inputs.
MC Patel sir is also there, I think, so we can ask him also to give his wonderful insights to
There are
the
so many seniors, and I would be very happy to hear their inputs for sure.
I would like to say that Dr. Riddhi is doing excellent job. I think she is touching upon the unmet needs of so many women. And what I saw just now, I joined little late, but beautifully explained what women wants. And I think wonderful presentation, and best of luck to Riddhi. She's going to be also presenting in our SOGO conference, and I'm sure she will do justice to the subject.
Thank you.
An expert. Thank you, Riddhi.
The last one or two slides, that the P in the patient.
Yeah.
That was really nice. That was really nice. And your clinic is awesome, Dr. Riddhi.
Thank you.
Your leaflets and your clinic is really nice. Can we have
Totally.
inputs from Archana ma'am?
Am I audible?
Oh, Nimish.
Yes, sir.
Yes. No, it was. I have been listening to this talk almost to the tune of almost 90% of the content, and it was really enjoyable. I mean, the way the subject has been approached. When we learn things in textbooks at a very young age and in a different era of time when medical education was in a different phase of time, and Dr. Neeta will agree with me through that. But with the understanding and with the growth of knowledge, as well as the change in pattern of social life, and one can say a type of an awakening, wherein things are discussed at a more focused level, and at the same time with more frankness and openness, without any taboos. I'm sure this area has a lot to progress and will bring a lot of happiness to several couples who have been subjected to wrong beliefs and things which actually hamper their personal lives, and will have a lot of emotional satisfaction, which will give them a better way of developing a good bond for the rest of their lives. So I think this is a very important session. Riddhi did a very good justice to the subject, and I'm very happy to have you all around. And it was a great pleasure, listening to Dr. Riddhi, and I'm sure the other speakers will be also doing a fantastic job. Thank you.
Thank you, Nimesh, sir, for
Thank
that
you, sir.
wonderful, exhaustive, elaborative, and quite informative input. Really nice to hear from you. Dr. Parul?
Yes, ma'am. So, I think we'll be taking the panel from here first
Yes.
and then
Yes.
taking sir's talk if sir would be available because some emergency or something is there. So, I would request our two moderators for the panel, Dr. Madan sir and Dr. Prerna ma'am, to take it further from here.
Thank you, Parul.
Welcome, ma'am.
Okay. Thank you, Parul. As Neeraj sir has not joined, we will proceed to the panel first. I welcome all the panelists and experts. My co-moderator is Dr. Prerna, and experts for today's session are Dr. Neeta Thakre ma'am, who is the president of Ahmedabad Society, and Dr. Archana Dwivedi ma'am, who is from Baroda and Foxy chairperson for Midlife Management Committee. I welcome all the panelists. Dr. Hira Kodiatar. Hira sir. He is the president of Porbandar Society. Dr. Piyush Vadalia, he is the president of Junagadh Society. Dr. Dolly ma'am has not joined. Dr. Divya Tekani ma'am is from Bhuj Society. Dr. Devanand sir is not there. Dr. Hitesh Chavan sir is from Bhavnagar Society. Dr. Rahul Patel sir is from Palanpur Society. Dr. Sonia Chandani, madam from Surat Society. And Dr. Varsha Prapanna ma'am, who has accepted our invitation. She is joining as a panelist. I welcome Dr. Varsha Prapanna ma'am from Baroda. Welcome all the panelists.
Dr. Madan, prior to starting our panel, I just wanted to say one thing for all the panelists, experts, and all the faculty, all our guests of honor, and everyone from Gujarat is that they are so much inclusive, very, very inclusive, and that is really a very good thing because I know my number was not saved with them any at any point of time, but then they were so very so very friendly over phone also. Thank you so much for that, everyone. And it's really a blessing to have you all.
Yeah. Bhavna, please stop share so that I can share. Is it visible?
Yes, sir, it's visible.
You can make it to slide mode.
Yeah, it's not full screen.
It has come full screen now.
Yeah. So today's panel discussion is on special topic which is related to adolescent sexuality, that is understanding adolescent sexuality. Actually, it is very difficult to understand, but we will try to understand and we have to be familiar with this subject very in depth, and actually because there are so many challenges before us to tackle these adolescent issues, may be troublesome many times. Yes. We all know what is the adolescent period, what is adolescence. But grossly speaking, adolescence is a transitional stage of physical and mental development, which is starting from the childhood to the adulthood. And so many factors are influencing this adolescent's life or the sexuality. The main factors are the gender identity, sexual orientation, and the culture you live in, and how your body develops. These four factors are responsible for shaping the adolescence. We know during the adolescence, in an individual thought, perception, as well as response gets colored sexually. And puberty is an important landmark of sexuality development that occurs in the adolescent, and which are the myriad of changes which are shaping this adolescent. These are the enormous stress which may have the adverse physical as well as psychological consequences. And regarding the understanding of adolescent sexuality, it is very important that so many factors like clinical, legal, social, and cultural and educational implications are also involved in that. There are three main domains in the development of adolescent sexuality: the cognitive development, emotional development, and the sexual development. That is why this is a complex and dynamic evolutionary process. As far as the psychological development in adolescence is concerned, there are so many changes happening in their life. Most important is the biological changes, that is the pubertal changes. In pubertal changes, we know there is increase in height, weight, and body mass. There are so many hormonal effects. That is the starting of menstruation is there. Development of secondary sexual characteristics is there. There are so many psychological and social changes happening there, which are going to affect their sexuality, like cognitive changes, some emotional and social changes, and also behavioral changes. There is risk-taking behavior, decision-making, their communication skill develop. Then they want to make their own identity and own decisions. So many changes are there. And as far as the emotional and social changes, the fear, anger, love, so many factors come into play. Then we would like to know from our esteemed panelists, what are the common psychosexual issues in the adolescence? Just you can enumerate which are the common issues in the adolescence. Anyone can take the question.
Dr. Varsha, Dr. Varsha, Dr. Divya.
Okay, yeah, all right. See, there is the identity conflict at this time because their sexual orientation is changing. They're not able to understand actually many a times what's happening to their body. And all this causes psychological conflicts also, anxiety, depression, guilt sometimes, and there are premature ejaculations happening, and myths and misconceptions about sex. That is the most important thing which goes about or goes around in this age. They learn things about pornography from their friends by reading some maybe on the net. Nowadays they use the mobile so easily, and so these are the psychosocial conflicts which are going on in their minds, and they are not able to talk it with anyone. Many a times they're not able to share, so they search for information here and there, and it's a really troubling phase for many adolescent children.
Yes, you are absolutely right, ma'am. Yes, Prerna.
We have Archana ma'am. She
Yeah.
can give her expert input.
Archana ma'am, are you there? Or Neeta ma'am can also comment.
In this adolescent group, no, sir, many girls will also have this complaint of breast pains because their breast buds are developing. So they will have vague pains, and often they are reading internet, the reels they are watching. So they'll be scared what is happening with because of breast development. It is there, and nodularity they feel. So they usually get worried and come for checkups. So many checkups we have this for this thing कि कोई गांठ तो नहीं है, एक बार मैडम आप देख लीजिए. So proper education is not there, and social media misguides them.
Yeah.
Absolutely. So
Parents
what I
always bring them.
understand,
Yes, ma'am.
what I understand is this is a phase where there are so many emotions going on at
Yes.
the same time, and that is
Yes.
the reason they are more confused. And
Yes.
in this, like I have been going for sexual, sex
Education. Yeah.
education in schools. So what I could see that when they find that comfort zone and they have confidence in the person who is standing in front of them, like us as a doctor, they open up so much, and kind of information they come up with. Can you believe that there was a class 6 student, and he was talking about G spot and what it is, and you know I was really surprised the kind of information they had, and he was a son of a doctor. So in today's time, the inhibition that we used to see in our adulthood, or when we were growing up, this generation is different, and to help them we need to have a proper counseling session kind of thing, and that is what support is the main important thing.
Yes, ma'am.
Very
Absolutely
true.
right. Due to this stress, anxiety, and many times their depression may be there, and we have to address their myths and misconceptions about sex also.
We have Dr.
Uh,
Dolly, Dr.
yes.
Sonia.
Yes. Many times there are menstrual problems and childhood marriage issues are also there, and we have to address main important issue are early and unprotected sex. There comes the role of sex education also, and we have to educate them about the sexually transmitted diseases, and we have to aware the parents also about the teenage pregnancies and their complications, and mainly we have to focus on the adolescents. The unsafe abortions are there, issues of sexual abuse are there, some addictive behaviors are there in the adolescents. This issue is rising so fast in the community, and depression and suicide, these are also very taking very high currently in the society, and we have to be vigilant about that. So our main focus should be on identity crisis, teenage pregnancy, and sexually transmitted infections. Then we will go with the cases. Interesting cases are there. Would like to request Prerna to take the first scenario.
Thank you, Dr. Madan. So I'm very glad to moderate this esteemed string of panelists, and really honored to have you all amongst us. And Dr. Neeta ma'am, our expert, is so dear to me, and it has been a long-term COVID relationship, you can say. Right at COVID, we met offline, and then on, ma'am is so very loving, and she's also always a yes. Thank you so much, ma'am. And I really vouch for your experience on adolescent sexuality that you mentioned, a class 6 girl or a boy asking about O spot and G spot. We get in our areas, we are getting adolescent girls coming with this abortifacient pills around class 8 and 9. They are reading around 14, 15 years old girls. So this is really getting so pathetic at times, and we need to educate them. So that is the motive of today's panel. And as we move on, we go to the scenario one, where we see that you suddenly happen to enter a 16-year-old room, son's room. Anybody might be a father or a mother to an adolescent kid. and you found the child masturbating. So how do you approach this? How much friendly approach should it be, or it should be something like a guardian approach, or how any esteemed panelist can throw some light on this? How will you take the child into confidence, and how will you make the child comfortable, and how will you make a eye-to-eye contact? Please throw some light. Dr. Sonia, Dr. Dolly, Dr. Anybody can take this up.
I mean, it's very often that whenever we are entering our kids' room, sometimes we find them playing with their private parts, just fond handling also. May not be actually masturbating openly. So, in such scenarios, I think the first rule as a parent, we must make that we knock the door and go so that they're also not in that awkward situation. But in case it has happened so, we should immediately be back. And whenever there is a right opportunity, because the kid is going to meet you and then he's not able to express his concerns and he might feel offended and have a little bit of self guilt. So, all those feelings have to be handled very positively, not as a parent, but maybe as a friend. And maybe we also, as kids, have undergone similar situations. And this world is so open, so they might be having concerns, and in spite of being a doctor, ourselves, we can always tell them that okay, let's meet an expert on this, and like whatever your concerns are, so we leave an open room for him for a discussion with an expert, and slowly then we can get involved into this. And in case they are coming up with some concerns to us, we should be very open. Rather, both the parents could be involved, the mother could also be involved, and we can tell them about the hygiene, the hair growth, the personal care, whatever should be taken. And in case they are masturbating or something, it's very natural, normal phenomena, and they should be doing it in privacy. So, what is normal is normal. How often to do, what will happen, what could be the consequences, all those has to be shared with a very positive approach, with no kind of colors as a parent, or provoking bhi nahi karna hai, but stop bhi nahi karna hai. So it has to go in a correct way so that they feel confident about our handling, because internet is open for them, so they're going to get misguided from the friends and from the internet. But the moment they find a positive handling from the parents' end, and they know that yes, they can connect to a senior person who is a doctor, I think they're going to do very well in their lives, and they're going to develop from adolescent sexuality to adult sexuality as a very positive person.
Thank you, Dr. Sonia. That was very well taken. And I really understand what you want to actually percolate amongst the delegates who are watching, that sex education has to be thorough and has to be a part of the normal curriculum, and we have to teach them what is normal is normal. And there is no guilt consciousness in this particular scenario. So can we have the next slide, please? Dr. Madan?
Yeah, this is the next question. Sex education.
You can take this up.
Yeah. Uh, as far as the sex education is concerned, what is our opinion? I mean, we would like to have your opinion that from what age it should be started, and should it be implemented in the school education? What is your open opinion? I would like to have from the panelists. And next, who is the right person to teach the subject? Yeah, anyone can take this question.
Okay, so recently I had taken sex education classes in two counseling in two reputed schools, and both the places the principals wanted it should be the same presentation for classes 6th onwards. Right from 6th she wanted till 12th. So I really had a tough time because the next question of yours is, who is the right person to teach the subject? I kept on pondering. I sort of argued with them that a psychologist would be a better person. But anyway, so it was a very interesting thing which I found about in these. Of course, I had taken only the girls. For the boys, they had contacted a urologist. So, and definitely what I felt that sex education should be a part of school education. That is definite. But I think they should include classes 8th onwards. That is what I felt. Because the girls of 6th and 7th, they were, like giggling, they were looking down and they were just laughing and they were talking to each other. So, this is my opinion.
Yes, ma'am, you are right. It was a actual dilemma before you because the 6th to 12th standard, there is so much of variation. Then
Yes.
6 to 8, 9, we can have the formal education regarding the anatomy of reproductive organs. We can
Exactly.
talk about the menstruation.
That is always there. That is the basis of the basic starts from there only.
Yeah, and I think about 10th class, 11, 12, we can address them about the this pregnancy
Yes,
hygiene,
unsafe
unsafe
sex
sex,
and
unsafe abortions.
teenage abortions and teenage
Yeah,
pregnancy. Sorry,
to
pregnancy.
avoid,
Yeah, and
yes,
STDs.
that we can
STDs.
address
Yes,
sexually
yes,
transmitted infections.
yes,
And
yes.
at the same time, if the parents are available, we can make them aware about their responsibility. And in the sexuality education, we have to give the right amount of information at the right time. That is also
Exactly.
very important.
Yes, yes. So in that place, Dr. Neeraj Jadhav was a great help to me. I took so
Yeah.
many slides from his presentation, and he was kind enough to share many of his presentations. He's not there today, but
Yes. Yes. Everyone has differing experience about the knowledge
yes,
of sexuality among the adolescent girls and boys
yeah,
because they are
yes,
always curious. Yes. This is the second scenario. A 19-year-old unmarried girl comes for consultation. She is in a steady relationship with her boyfriend and she wants to take the things to the next level. She wants contraceptive advice from you. Then how will you guide her? How should be our approach? She is 19-year-old. Yes.
I would appreciate her that she has come to us for asking that what should be the right choice for her, and she knows that what she's expecting in the future. So I would like her to come with her boyfriend also to understand how serious the boyfriend is also, what kind of sex they want to have, because it is to be discussed in detail. Sometimes it is vaginal, sometimes it is different types of sex they want to do
yes,
because of the, kind of things available online. So, and then we need to tell them one on one as per their questions. We need to follow up whatever contraceptive advice we give, the safe period, the unsafe period, how often, and what would be the consequences if they're not using the barrier method. And in case they're using the barrier method, also still both of them need to be vaccinated for HPV. So all those things slowly, slowly, and are they really serious about this relationship to be taken to not only the conception, contraception level, but in future also, because these things too have a kind of mental impact slowly in their psychological growth. I mean, these days the relationships are just for few months and then she is into the next boyfriend or something. So as a mentor or guide, and then maybe if the girl is known to me, like her parents have been coming to me, so that confidentiality also needs to be maintained to certain extent. So it has to be definitely taken very beautifully as a kind of how we practice in Western world or other countries. Contraceptive is their right, and once they're approaching us, We need to give them the best, which is very safe because she's just 19. So all the other his family history also needs to be ruled out. Or if we are giving her some kind of hormonal pills or something, and then what are the warning signs she needs to be careful about. So all those simple things needs to be explained.
Okay.
Dr.
Yeah.
Madan, here I would like
Yes.
to give one
Yes. Yes.
input. It's like what has happened with me just a couple of days back. The openness of parents regarding contraceptives for their kids. An adolescent girl's father, around she was 17 or so, and she was going to study abroad at Australia. And the father brought the adolescent girl to my chamber and said that she is going to Australia with and her living partner will be her someone who is seeing around her, and so maybe her boyfriend. So doctor kindly advise her oral contraceptive pills because I do not prefer that she becomes pregnant there. So she he because Australia and these countries, they're not giving prescriptions OTC. So he purchased from our clinic only. He purchased almost 6 months OC pill at a stretch, and he had given it to her daughter, and those so that she carries it to whoever's partner she is being with. So that is some openness I saw that is coming up so at large. So Dr. Neeta, if you can like just take up this, if you can highlight anything on this, the openness of parents on contraceptives for children. That is really something new that I saw. I have never seen this earlier. If
Yeah.
anybody has any experience on this, he particularly said that I don't know, I don't believe in condoms for my daughter. And please prescribe her
Oh,
OTC. Yes,
yes.
and
Such
he
a
was like
open.
very
Yeah,
open and very
I
cool.
do have.
Hmm. Yes.
Yes.
I do so many parents coming and talking about their kids' sexual need, contraceptive need, whether kids are married, unmarried, in relationship or whatever. Because now they've understood that what is important is they should not get infection as well as pregnancy.
Yeah. It's a very good step ahead, actually. uh,
So, can I ask a question? Would OC pills be right for her? Suppose she takes it continuously for 2 years or 3 years or whatever?
Definitely not, ma'am. She needs to have
Yeah.
the full
Okay.
evaluation.
That's the take home message, maybe.
yes.
Sometimes I do ask for both if it is not for a longer period of time. OC pill for pregnancy protection and condoms always for infection
Yes.
control. So I usually ask them to use both.
Yes.
Okay. Yeah. This is again one tricky situation before us. If her parents are doctors and your best friends, what will be your take?
We have to maintain the privacy,
Yeah. Her
isn't
parents are
it?
your best friends, then it is your
You have to
responsibility to tell them.
maintain the child's privacy.
It is not the not your
Madan, I
responsibility to
have
tell
a
them.
very important thing to share. Actually, I had a patient, very close friend's daughter. She was unmarried, having sexual relationship. She missed her period. She came to me, said, Auntie, I missed my period. Probably I might be pregnant. Can you get it checked? And though she knows that parents are my close friend, then she asked me that I know that after marriage I have to come to you for all my pregnancies and all the problem. So because you should know my history from beginning, that's why I'm here with you with my boyfriend. So this
No.
generation is very open. They know where to play safe. So then you have to respect that. And of course, though the parents were best friend, I see her as a patient, not my friend's daughter.
Okay. ठीक है. Prerna, can you take this?
Yes, yes. Very well taken, Dr. Riddhi. And we move on to the next scenario, which is a 20-year-old female student comes to your clinic and she recently had an unprotected intercourse with a new partner. Now, she had two other partners in the past and pretty young to have so many partners. So she is asymptomatic but worried about contracting infection and asked to be testing for everything. She is coming to you and she's approaching that please test me for everything because I'm worried about infection because I had multiple sexual partners. So how do you approach this case and how will you manage this patient and how will you counsel her regarding the entire uh, issues that she is facing? Anyone? And Dr. Divya can take this up.
Dr. Hitesh sir is there, no?
Dr. Hitesh had some emergency. He had to leave. Maybe he is
Okay,
online,
okay.
but he is
Yeah,
not there.
okay, okay.
Dr.
Anyone can
Divya,
take.
Actually, we will take her into confidence. We will just explain her what situation she is creating for herself, both sexually, physically, and emotionally. So, we just take her into confidence so that at least she feels free to talk to us and explain her what are the scientific reasons of everything.
yes. Just Dr. Riddhi has mentioned that she needs dual protection regarding contraception as well as preventing her from STIs. It's very important that we take into account that all her 5 Ps of sexual history has been covered. Her number of partners, what type of practice, what type of intercourse is she undergoing, what protection does she regularly use, and what about her past, whether she has ever suffered from any history of sexually transmitted infections, and how can she definitely go ahead and prevent pregnancy with proper contraception use. So I'll not go into much detail of these. And
We just to interrupt, we must communicate to our patients, these girls, about the high risk behavior which they are taking for themselves. We should try to help them protect themselves also. We should guide them also, actually.
very true, ma'am. And we can ask her some certain leading questions, whether she had
Yes.
certain discharge and what was the color of the discharge and what was, if there were any ulcers or there were any swelling or any sort of conjunctivitis and all these associated symptoms that we usually see with STIs. We can give her some leading questions so that
Yes.
she can point out whether she had certain symptoms and we can approach to a diagnosis in her case, even if she had no leading questions that might be answered earlier. So these are the disease profile and all the test and the commonly associated infection profile that we usually get in the day-to-day practices. Nowadays, this has been shifted to the gum clinic in the NHM setups. In our place, I don't know about the other areas. Dr. Madan, what is your experience? Because in our area, if we have a VDRL positive or a HPV, this is even on a pap smear, we have an HPV positive case. We need to actually report it and inform the Joint Director of Health Sciences in our district and has to refer to the gum clinic, the genitourinary clinics in the PHCs and the CHCs that are available, the FRUs, the first reference.
These are
We
available
cannot,
at sub-district hospitals and district hospitals or
yes.
the medical colleges.
No, since we are private practitioners, if we get a report of VDRL positive in our clinic, are
Then
you?
we have to report.
Yes, we are also reporting. Yes. Mm. So this is you can take up this scenario 4.
Yeah, you can proceed.
आप ले लो.
Okay. Next scenario is a 17-year-old female student comes to you and explains that she has recently been attracted to her best friend, who is also a female. She feels afraid to accept this as all her other friends are attracted to the people of the opposite gender. She thinks that she will be ostracized by her peers and the society. And she comes to you. Then how will you solve her problem, or how will you proceed to manage her? How will you counsel? She has attraction to a female. Then how this case should be handled? Yeah, anyone can take this.
Till the adolescent kid is growing, their gender identity will keep changing. I feel sometimes it does happen that they start liking the same gender. May happen for boys as well because they spend more time together. They have similar likings, and that's why the attraction is known. So we should explain them that yes, you're growing, and it may be normal that you like the other person some particular habits or something. And slowly, as it is a transitioning phase, and when they become adults, it may change as well. So we need to accept it very positively and keep guiding them as a team. Maybe sometimes we need to involve the endocrinologist, get some hormone levels done Also, in case we find it necessary, and a counselor and a social worker as per the cases. So, but then we as gynecologists must accept it very positively, and the child also should be made to accept it very well.
Dr. Madan, I'll
Yes.
point out one very important thing here is that
Yeah.
once we see this case of a girl getting attracted to a girl, a very important thing that I got to know in just a couple of months back, that this girl who was attracted to a girl, she came to my chamber, and then when I took her entire domestic history of her lifestyle and her family members, there was this male ego-dominated societal patriarchal structure that she was
Oh,
actually hovering on her mind, that what big deal to get attracted to a male when males are like that. They are dominating the
oh,
family. They're shouting at their wives. They are just not cordial with their female counterparts. So she had a father who was not very cordial with her mother. Like the husband and wife relation was very rude type of, very abusive in nature.
okay,
So that led to a mentality that she should be attracted to girls. So that was not her inherent lesbianism. That was something which was a behavioral change. And then she started getting attracted to girls. So we need to understand this very basic from what societal structure or what patriarchal symphony that they are actually getting grown up with. So it's very important.
So these are psychosexual issues basically. And
Yes,
she is
ma'am.
maturing. See, they say that by 20, the girls will mature, but maybe she may take a year or two. And during that, her, like you said, her liking pattern may change also. The environment is also there to change so many things.
yeah. The case the Prerna has shared is really a different case, because this family environment really affect this thinking of these adolescents. Yes, counseling part is very important in such cases. They should come out and tell their
Yeah.
feelings about their sexual orientation and sexual identity. And
Yeah.
this LGBTQ plus family is also coming up now, and we should very well counsel them that there are many support groups about that, and government is also now supporting them. They are coming into the society on well positions also. They can have their well education, well positions in the services also. uh, yes, we will not go into the details. What is the section 377?
Actually, lot of children ask about this LGBT also.
Yeah, and they search on the Google what is LGBTQ and all this.
Yeah.
That is why school education is very important actually. I think when we go in the colleges to
Yeah.
give this educational talks, we should include this about 10 students. I think we should include this subject in short at least.
Yeah.
This section 377, actually it is the section of Indian Penal Code which was introduced in the British rule. And it was about the sexual intercourse against the order of nature. But in 2018, Supreme Court of India ruled that the application of section 377 to the consensual homosexual sex between the adults was unconstitutional and irrational, indefensible, and manifestly arbitrary. But that section applies when it is related with the sex of minors or in cases of non-consensual sexual acts, that is applied. So that is the order of this Supreme Court. We should know about this. Prerna, are you taking this
Yes.
scenario?
Yes. So we are going great, Dr. Madan, and all our panelists are really giving their best inputs. And we move on to this very important scenario where the school authorities are reporting that some student of standard 9 have been caught watching porn. So this is very common in today's scenario because media and the internet is so very well available to every kid since COVID was there. And they want you to address the students about the same. They call you as a expert, and then they also want your opinion whether concerned students should be punished or not. So, Dr. Varsha, can you give your opinion on how to go about it? So this teenage students watching porn and then
Yeah.
getting caught. Mm.
Yeah.
Yes, ma'am.
Basically, this will be a behavioral, isn't it? Behavioral problem. Because their brains are developing, changing, and just like you said, they have so much information at the click of the finger, and they like with their friends, with a group, then they would like to look into all these things. They enjoy sometimes. Because they are in a group, their friends are like that, and there's a lot of peer pressure also for these people sometimes.
Yes, ma'am.
So
And
maybe they like watching it also, which later on they may regret. That is different.
so, ma'am, what as an expert and as a healthcare provider, we obstetrician can do is that instead of asking the school authority to punish these students, we
Yes,
can ask
definitely.
them that yes, we can tell them that they definitely had some lack of sexual knowledge, or maybe they
Yes,
were
yeah,
inquisitive about what the
yes,
genitals mean and how do the genitals club or how do the genitals gel in during intercourse, and that is why they were actually watching 3x or 4x. And this is why we need to actually popularize sex education in the students of class 8, 9, 10, as we have already discussed. Can we move ahead, Dr. Madan? We are almost
Yes.
into time. Yes. So these are some certain classifications where we can have the previous slide. The previous slide. This is a McAfee 2012 study which had
Yes.
exposed almost 10 ways teen hide their online activities from their parents. So they clear the browsing history, they hide or delete the videos, and they omit the details of their online activities by various measures. They can have it in a very intelligent manner. So it is not that you are all the time spying the teenage boys and girls,
yes,
but
yes,
it is about being vigilant. So
yes,
about being vigilant and about being apprehensive, there is a thin line in between. You cannot be apprehensive about your ward's behavior, but you always need to be very clear and very certain that, okay, my daughter or my son is not watching anything very obscene over online, because it's very open nowadays, and you have to tell them in clarity that these all things can definitely have a loophole in having cyber crime elevation in
yes,
their life, so that they might be cyberbullied in the near future if they continue with this behavior. So this is where we can manipulate their minds, and also
yes,
very importantly, very importantly, we need to understand that these teenage are very vernacular to all these very vernacular, very vulnerable group
yes.
of children, very vulnerable, and they can even commit suicidal attempts if they are exactly punished for their guilt consciousness. So that's very important to understand that. Can we have the next
So the
scenario?
bottom line is a good
Yes.
communication with the parent, the friend, the elder, or whatever. And the children should also feel safe. If they talk to someone about these issues, they will not be rebuked. They will be understood. So communication is the bottom line.
Yeah, one of the last webinars
Yes.
we had one of the experts had said that a parent has to be a parent. A parent
Yes,
can't be a
yeah.
friend. You can't just sit in front of the child and say, "I am your friend." You start
You
speaking.
can be a friendly parent.
Yes, yes, yes. So yeah, we can move on to the next.
Yes. What are the social and behavioral implications of psychosexual issues? There are so many implications, like there is impact on relationships, uh, relationship with friends, family members, there is father, mother, sister, and there is impact on self-esteem too. There may be negative impact on the school performance because of these psychosexual issues. they may indulge into the risky sexual behaviors and with their consequences also, like sexually transmitted infections, unintended pregnancies due to the unprotected sex. And there are so many challenges before us, like coercion is there, sexting is there, cases of sexual abuse. Many incidences are happening about the sexual abuse, and these adolescents are hiding from the parents due to the threat also. There are so many misconceptions about this sex. And one more most important is drug addiction. It is rising day by day. Drug addiction is there. It is becoming more easily available in the market. Drugs are available and people are indulging into it. That is a worrisome part of this situation. Then in such situations, how to address these issues in the adolescent? This should be addressed so softly and gently. Then anyone can take this, how to address these issues to the adolescents in short? Yes, Dr. Divya, Dr. Riddhi ma'am.
Yeah, so the best thing is to uh, try to understand that what sort of a psychosexual problem they are facing. The history is very important. And as Prerna rightly mentioned, that what is their socio-cultural context is there, what kind of a culture they are growing up, what is a social life they are having. That will help you to understand that why he or she is facing this problem. And
Yes.
then knowledge, because you provide them regarding infections. Rather
Yeah.
than telling them not to have sex, you would ask them to have a safe sex.
Yeah, that is right.
Okay. When they are addicted to porn, you provide them with just don't replace it with a better scientific material. Because once they are curious, they want to know, for see, why a person is on a porn, because they want to know something. So they are curious mind.
Yeah,
So
their
always
curiosity.
feed them with a better scientific information. So rather than removing, just replace the type of source and information. So that is very important. And counseling plays a extremely important role. They may not open up in a one or two sessions. Give them a time. Non-judgmental listening is very important in a sexual practice. You have to tell them that I am not going to judge you. I am not going to judge about your sexual practices, your partner preference, nothing. So these three, four key areas are extremely important to address psychosexual problem.
Yes, ma'am, you are very rightly addressed. And of course, definitely there is role of parents, role of educators, and we as healthcare providers. These are few recommendations for the parents. Not to give a smartphone to a child until the age 14 or more, and have a watch on the computers what he or she is browsing. Uh, Then talk with the parents of your children, friends, and update on their realities of internet pornography. Recognize that up to 90% of pornography is not commercial, but rather from amateur production and distribution, such as thorough sexting. And so many things are there. But we have to keep a watch on them with gentleness and with open communication. Then,
Can I just ask a question? What is the role of the gynecologist in such behavioral issues?
yes, ma'am, just we have discussed this thing. Go into the detailed history and that this previous slide one. This is our role to
Yes, so I
counseling.
got it. I got it.
To
I
educate
got it.
and counseling. Then here is the role of society also. Then which parts of the society? Everyone is responsible and everyone should be involved in this process. Like parents, brothers, sisters are also very much important. Then other persons like relatives, friends, family friends, teachers also. healthcare providers, religious leaders, traditional leaders, politicians, journalists, bureaucrats, anyone. Everyone's role is very important in this.
Dr. Madan, as regard to the friends group that you have mentioned, the role of the family and society as well as the friends, I being a mother to an adolescent girl, my daughter is 14. So
Yeah.
I had this problem of understanding the behavioral pattern of these peer group. Now,
Yeah.
if a girl is adolescent, 14, doesn't mean that she has all information about what is to be like a girlfriend to a boyfriend and what is it to be like sexually intimate. And the same group girl, maybe she might be having 4 5 other girls in her group of the same age, and their level of understanding is pretty high. They understand what is intercourse, they understand what is eye pill, they understand what is, and this one particular girl doesn't understand anything. So this there is a lot of understanding, level of understanding difference between adolescent, what I've seen or what I've felt, because this thing has to be dealt with. Because once you go for any sex education class or something, this girl who had an idea of everything in life, IPL से लेकर के sexual intercourse से लेके everything, she'll be very easy and versed with that class. But one who doesn't even know what is boyfriend and girlfriend, that kid has to be taken, yes, that kid has to be taken quite apart from what the other kid's level of understanding is. So this particular thing has to be taken into account, I feel.
Yes. Yeah.
What do you say, Varsha ma'am?
Yeah, so that is, we have to understand the psychology maybe like of all of them.
Yes,
Yeah.
ma'am.
Okay. We
We're
are at
almost
the end
finishing
of
on
the
time.
session.
We can
Yeah.
have one take-home message prior
Yeah.
to giving us a humble appeal.
Yeah. One take-home message from any of the available
Please call
participants.
your blessings for our next election candidature,
Yes, all
Dr.
the
Madan,
best,
for
all the best, both of you. All the best, both
thank
of
you, ma'am.
you.
Thank you
Thank
so
you,
much.
ma'am.
और
Thank you so
पार्टी
much.
पार्टी कहाँ पे दोगे? पार्टी इस तरह से नहीं हो सकती.
पार्टी तो ऑनलाइन नहीं होगी, ऑफलाइन ही
Where
होगी.
are you, डॉक्टर कामले? आप कहाँ पे हो?
महाराष्ट्र से मैम,
नहीं
सोलापुर
नहीं,
डिस्ट्रिक्ट,
अच्छा अच्छा, okay okay.
महाराष्ट्र.
And yeah, Prerna, you said you are from the east. You mentioned.
Easternmost east,
पार्टी
ma'am.
एडवांस में दे दो.
Okay.
You are
Geeta ma'am,
already rocking.
okay, thank you. Thank you
Thank
so
you so
much.
much. Thank you so much. It was actually
Excellent,
wonderful discussion.
excellent discussion. I
Thank you,
was
ma'am.
there all throughout, though in
Ma'am,
between.
ma'am, रुक जाइए. First take all our love.
Ah, ले लिया.
Yes,
And
ma'am,
we are
it's so lovely.
coming to Sogog. आपको क्या
Yes.
चाहिए ईस्ट से बताइए.
बस आप आ जाइए, बहुत हो गया. अभी लाइफ में चाहिए चाहिए सब बंद कर देने का है.
नहीं,
ऐसा
आप
है.
आ जाइए, वो भी तो चाहिए हुआ ना.
वही तो बोले मैं कि बस
आप
आप आ
चाहते हैं
जाइए,
कि वो
बस यही
आए तो.
मैम आप
ये
कुछ
ना,
बोल रहे थे. I interrupted you.
yeah, no, it was really very informative and very kind of frank discussion which we need to do amongst ourselves, so that whatever is, sometimes you are not touching upon a few finer points when the patient arrives. So these discussions will lead us as a better uh, you know better, what would I say, maybe a counselor, maybe a therapist. And that is how, these discussions are very, very useful. All the experts had excellent points to, summarize. And of course, your presentation was excellent. And I must say that though it was little, chaotic for me, because you are practicing and in between you have to start with this and all that, but this was worth it.
Yes, thank
Thank
you
you,
so
ma'am.
much, ma'am. Thank you so much.
And ma'am,
Pleasure.
we have club sexual medicine and young talent just because of
Yes, yes,
this particular thing that the
yes,
youth
this is
need
very
this
important
sexuality
topic.
education.
And at times I remember when I was there to as a parent, single parent to my growing kids.
Hats off to
and
you.
and it was quite difficult because they had so many questions. Why that white color fluid coming out of my penis? All those things. You then as a mother and as a doctor, you have to answer all those things and be their confidant and be their guide as well. So these are the points which are, I think, day to day practice you are facing, and in your personal
Otherwise,
life
ma'am, we
also.
say, na, otherwise, whenever a kid asks us, "ये baby कहाँ से आया?" then we say, "भगवान ने भेजा है." We say this only.
No, we don't say that now, Prerna. I have
Exactly.
not said it since years
Yeah.
to
We
my
have heard this,
patients.
ma'am. हम लोग तो नहीं बोलते. मतलब हम लोगों को तो ऐसे ही बोलते थे ना मैम जब हम लोग छोटे थे.
We don't tell them how they come, how
Yeah.
they are made, how they are made. We don't tell them that.
But
Anyway,
it's high time that we give them good education, good
yeah.
touch, bad touch. So many, social evil things are happening. And that's why it is very important for all of us as a, consultant or as a guide or as a, someone who can understand their feelings in and out. And, it's our responsibility to guide them, actually. So good, enjoyed, and I think it's time to say goodbye because
Yes,
now
and thank you, Dr. Kamble and Prerna.
yeah,
Bye.
thank you.
Thank you,
Thank you
Varsha
so
ma'am.
much,
Special
ma'am.
thanks to Varsha
Thank you,
ma'am.
Madan. Thank you, Prerna.
Yes,
It
thank
Varsha
you
was
ma'am,
all.
special thanks
Thank
to
you all
you
the
for pulling the
faculties.
panel so well.
Yeah.
You
All
were-
the faculties are excellent.
Surprise gift.
But you really pulled it so well, ma'am.
Yes.
Thank you,
Absolutely.
ma'am.
Yeah,
This
okay.
one was excellent.
Thank
Good
you, ma'am.
night.
Okay, bye-bye.
Thank you.
Bye. Thank
Yes.
you.
Good
Thank you all
night.
Gujarat societies and thank you Corona
Yeah.
for this wonderful platform. Yeah. See you soon.
Bye-bye.
Yeah, thank you. Bye.
Yeah.